libraries, bringing public health home. And for those of you who aren't familiar with the National Collaborating Center, we are one of 6 centers that were started, interestingly, after the first SARS epidemic here or globally, to deal with emerging issues related to public health. And the National Collaborating Center for Environmental Health deals with environmental health related issues pertaining to things such as climate change, emerging infectious diseases, healthy built environment, and vector-borne diseases, etc. So I'm going to talk a bit today about why I think libraries are excellent public health partners. And Walter's going to share a bit more about how public libraries are already engaging in really interesting and innovative public health outreach. And then I'm going to talk a bit about radon gas. And then Walter's going to explain how his library adapted some radon gas programming. And then again, we want to just ignite a bit more collaboration. And hopefully you'll leave this talk today with some ideas about what you might be able to do. And just to flag that we actually have a paper on this topic by Eykelbosh, who is joining us today for the chat in Environmental Health Review. So in 2023, there'll be a citation as well related to this work. So why are we interested in public libraries in public health? Well, in part, it's because most communities actually have one. And what I realized when I went to the library to work with Walter was like, wow, people come here for information. And in public health, I spend a lot of time trying to tell people things. And here's a place where people go to learn new things. So this was a really interesting, different perspective on knowledge seeking or information seeking. I also realized quickly, and I kind of knew this right from having a child and being a child, is that libraries attract a broad cross-section of people. And we know people come to libraries from cultures in which they're getting programming in non-English languages. People come for all sorts of different services, early childhood education, story time. There's all sorts of reasons why people come to the library, and now more recently, including things like access to the internet and access to technology. And in that case, in many ways, you can see that libraries promote equitable access to things such as information, books, music, the internet help. And in many ways, these are overlapping goals with public health, because we are also helping to promote equity within public health. And so there's a really nice, I think, overlap between these shared goals. And this is just an example of what's called a med shed. So on Bowen Island, they have a med shed in their library where they actually lend out medical equipment to people who have either had surgical procedures done and they need extra things like grabbers and stuff that they don't want to have to buy while they're recovering, or if they have a visiting relative coming from somewhere else and they need equipment while they're there, you can borrow a walker for free. And then they do have a rigorous decontamination process before the equipment is reused. And there's limits, of course, to what is reusable, but they try to make use of resources and reuse resources in a really helpful way. So libraries have really expanded in many ways from the traditional things like just lending out books to services and activities and loaning out kits or devices like the radon detectors that we're going to talk about. And these are offerings that are often based on the needs and the interests of the specific communities. And on Bowen Island, there tends to be an older population. And when I went to speak with people there, they also have equipment donated to them over time. So it's just been a natural evolution of things that are available for lending in that community. But more and more, we're seeing libraries getting involved in health and wellness programming. And Walter is going to speak a bit more about some of those opportunities. So I'm going to switch gears just quickly to radon gas and why radon was such an excellent topic for library work. It's a colorless, odorless, radioactive gas, and it's the second leading cause of lung cancer after tobacco. It's estimated to cause over 3,000 lung cancer deaths per year. It's an indoor air contaminant. And the only way to know if you've got radon indoors in your home is to test. And you're supposed to reduce the levels if they're above 200 becquerels per meters cubed, which is the unit that we use to measure radon. And one of the biggest challenges that we have with radon gas in Canada is not detecting it, but it's getting people to test for it. And so over time, these are some statistics on what radon awareness is in Canada. So you can see here that, just about 50% of people now know what radon is, but very few people are testing for it. And there's a number of different reasons for why people are and are not testing for radon. But one of them is just, historically people haven't known a lot about it. And then there's connecting people to the equipment that they need to test their home. So testing is not particularly expensive. Necessarily, it's $40 to $60 to buy a kit, but for some people that might be a challenge. And also in many ways, it's a new idea for people to just, send off and get a test kit. So turning to the library was something that we thought would help us both provide some support and context for people who are interested in doing radon testing, and connect them with the devices that they could use to test for radon in their home. And what we've really done with the libraries is try to focus on places where we know that there is radon, but there hasn't necessarily been enough awareness and testing. So I do run projects across the country with the Take Action on Radon team. And where we found is that there are certain parts of Canada that have more radon gas than others. And so it's more important for people to encourage people to test. This is some work that we did in the interior of British Columbia. And so in these regions where we have high radon levels, we've then gone to libraries and encouraged them to adapt to some of these technologies so that they can lend them out to people. And so this device here, and Walter will talk a bit more about it, but these are what we use as screening tools. And then we encourage people to follow up with the small black thing that looks like a hockey puck. These ones in the front, these are the longer term 91-day testing devices, but these ones that we lend out give people a sense of whether or not radon is an issue in their home, and then we have information encouraging them to go ahead and test. So just to say that right now, what you need to do is test for radon, and then if you have it, you need to remove it from your environment because that's the way that you'll prevent lung cancer. So the testing itself is not enough, but the testing is the first part in an exposure reduction program for lung cancer. And we've tried lots of things to encourage testing. We've tried things like providing people with maps. So here in British Columbia, we have an amazing resource that allows people to see what testing has been done. And this is helping getting people oriented to and interested in testing. We also provide free test kits to communities that are interested in doing it. And then the federal government does ongoing research, continually trying to update Canadians to raise awareness about the fact that radon is a problem that they need to test for. But again, these initiatives, we're still only at about 50% of people that know about radon. So this is where the public library piece comes in, because there's a 50% more people that we could reach. And we suspect a lot of those people visit libraries. So I'm going to hand it over now to Walter, who will explain how and why they decided to take on the Radon Device Lending Library program. Are you there, Walter? Can we hear you?
Yes, you can hear. Okay, I hope you guys can hear me. Can you hear me?
We can hear you. And
perfect. Okay, good. Okay, good. Okay. Now, where to start? Okay, I'm going to just explain. I always think that everything requires a little bit of context and background. So I'm going to just start with the background, and then we'll get into how the whole project went developed. So what happened initially was there was a group of people, a group of researchers from the SFU Department of Health Sciences, and they were doing a research project. And that's where Anne-Marie comes in, because she was actually one of the researchers, or really spearheading the whole project. And they wanted to make radon detection meters available to the public. So they contacted the library, they set up a kiosk in the library, and they advertised it actually, I believe, in the local paper. And there was actually a huge response to it. And basically they said, hey, if you guys want to borrow a radon, detection meter, come to the library. We will, give them to the public, so you could use it, and so on and so forth. And this project was done in conjunction with the folks from Health Canada, as well as the BC Lung Association, which is now known as BC Lung. And they basically did this as actually a pilot project, and they decided to do it here in North Van City Library because I guess that we're kind of like a bit of an epicenter for where radon would be probably prevalent in homes. So they actually had an enormous or a really huge response from the public. And we were thinking, wow, like we were quite shocked, actually. We were like, oh, wow, folks are coming in here. So a lot of people were definitely interested in this. So the whole research project proved to be very successful, and demand was quite overwhelming. And then it was from there that we started to really get thinking about how we could actually develop into this. So with the success of the research project, it was determined that the public library would be the perfect agency, we thought, through which radon detection meters could be made available to the public. So Anne-Marie contacted us at the library saying, hey, you know, we've had such a great response. We would like to have these made available to the public through the public libraries, so kits that could be circulatable, so on and so forth. She mentioned, or she knew that Halifax Public Library was already doing a similar program to this. And they were actually having quite great success with the kits that they had made available to the public. So the nice thing was there was a precedence that was already set in Canada for libraries doing this. And we thought, okay, hey, this is something we could definitely do. So we organized a bunch of meetings together, and we determined what was going to be the scope of this. And I know Anne-Marie was hopeful to actually contact all the other libraries, such as those on the North Shore, which is West Vancouver Memorial Library, North Van District Library, the Sea to Sky Highway, the libraries there, so in Pemberton and Whistler, in Squamish, and then also with the Sunshine Coast, which would include Gibson's, Seashell, Powell River. Now, as a librarian, I know one thing: it's easiest to get into libraries through another library or librarian. So I suggested to Anne-Marie, I said, well, listen, if these are all the libraries you'd like to reach out to, no use having everybody reinvent the wheel. So we decided to take on the task of contacting the libraries, find out if they were interested in working on a project in which they would receive some of these radon detection kits. And the caveat was I kind of organized it on my end, in which I would kind of receive the materials, catalog the materials, process the materials, and then make them available to other libraries. So basically all they had to do was receive the stuff, go on their barcode, their RFID tag, make them available for circulation to the public. We also created a lot of information, like our webpage information that will provide some background to radon, as well as like the radon detection kits, as well as a lot of our PSA information, so on and so forth. We shared that with other libraries too, so they wouldn't have to just do it on their own. And that way we would have kind of like a consistent program across what was about 10 different libraries. Okay, so next one. When we were actually launching this, we were working with a group of different agencies that actually had to help support this program. So of course, besides the folks at SFU and the Faculty of Health Sciences, Canada Health was on board, as was the BC Lung Association, or BC Lung. And there was an agency known as AirThings. Now, AirThings is a Norwegian-based company which actually develops or makes or produces radon detectors. So through Pippa Boothman, who was actually involved with AirThings, we met up with her, and they were able to actually provide us with a whole bunch of radon meters, or radon detection meters, for free. And God bless Anne-Marie, she actually also wrote some grants to kind of help support the program. The other agency that was really involved was what we call Public Library Interlink, and that is actually the consortia of public libraries in the Lower Mainland. So I knew with the folks on the North Shore, Sea to Sky, as well as Sunshine Coast, that they would have to be on board. And the interesting thing was Public Library Interlink, all the other libraries like Vancouver, Burnaby, Fraser Valley, and library systems that are involved, they were kind of keeping an eye on this just to see how it worked out with us, and to find out if they would be able to kind of piggyback maybe eventually, but they were kind of waiting to see how it's going to work out with us as a pilot. Okay, so this is what essentially the radon detection meters look like. We basically created a bit of a tub, and in the tub we have the radon detection meter in here with this little box and the instructions to it. And we essentially just catalog these items. And you know, we have our barcode, like this is like a cover sheet. And inside the kits, we also have information on how to use the radon detection meter, as well as items that were provided from Health Canada, as well as BC Lung, such as like, you know, the ephemeral materials, brochures that would give a little bit of context and background to people. So what we do is we throw everything in this tub. We actually have it barcoded, and then we also have it in our library catalog, so people could search for it in the catalog. They could place it on hold, and when it's available, they could take it out, and we made them available here for 6 weeks circulation. Some libraries decided to have it for 4 weeks circulation, but we made ours available for 6 weeks circulation. Okay, so that's essentially all the stuff that actually goes into these tubs. Now, so as I said, each kit, it contains the one radon detector and the user manual. an instruction sheet, and government information brochures. And that was the Take Action on Radon. Radon, is it in your home? Radon, another reason to quit, and radon reduction guide for Canadians. So that's the actual physical items which are in there. Luckily, most of the brochures and things were we got, of course, from BC Lung and Health Canada, and with the meters in there, we had to create a little bit of information ourselves, but it wasn't too bad because once we had all the pieces together, we just had to, as I said, just place them in tubs, catalog it, process it, and then they're ready to go. The libraries that were involved in this pilot that we did for this first kind of like step, there was about 10 libraries involved. So North Shore Library, Sunshine Coast, and Sea to Sky Corridor. We distributed, I think a total of about 42 kits to all the different libraries. So some libraries got more, some libraries got less. Like North Van District Library, larger library system, we gave them 7 kits. We had 6 kits here. Bowen Island got 2, so on and so forth. We gave lots to Whistler because Whistler seems to have high rates of radon or high levels of radon. So we thought to kind of like give them to areas that we thought where they would really need them. Now this project itself, when we were actually first starting out, we launched the project itself in November of 2018, and it was mainly to coincide with Radon Detection Awareness Month. So it was November 2018. And as I said, we took on the task of, cataloging, processing, distributing all the stuff. And the one thing that we realized that we needed was information. Now, the folks at SFU, they were very interested in the information that we would get. So we actually also created a survey in which people that would take out the meters could actually just log in and just fill in just like a survey about what the radon, like what their radon levels were, what they thought of the program, so on and so forth. So that was actually, that was a good piece, and that was actually a very valuable piece. I wish that we could have been able to really support that in a lot better ways, but you know how it is when you have the public kind of like voluntarily giving information. Sometimes it's a little bit harder, but I believe that a lot of information was called for this. So there were successes and challenges. The successes, one thing that made it really easy was coordinating through one library to help streamline the program. As I said, if Anne-Marie would have to contact all the 10 different libraries, it probably would have taken forever. And then, of course, all the libraries would probably have to get the board's approval, so on and so forth. So that's why we thought it was easier to infiltrate into the other libraries through Interlink, through the consortia, as well as approaching them as a library or a librarian, talking to library and librarians. All libraries involved, they were very receptive, luckily, and they promoted these within their communities. I know that probably the best success story for this was probably North Van District Library, because they have like perpetual holds on these items, like long hold lists and things like that. Like it's almost like they can't supply them fast enough. There's been amazing public response and usage statistics in all the libraries. They are circulating and they're always circulating. And the funding was relatively easy to access. I mean, of course, Airthings did provide a lot of these like meters for free. So that was good. But through grants and things, that was actually a good success. There were some challenges. One of them was a very tight project time frame. We had about 2 months from kind of start to delivery, which was a little bit kind of quick. But it worked out. The cataloging, processing, promotion did vary a bit. As I said, I did the cataloging, processing, but and the promotional materials, but all the libraries had to kind of modify it for themselves, and some, I think, did some major modifications, some less so. And well, the patron survey, as I said, it was like, we were kind of at the mercy of the public voluntarily giving their information and logging in and signing in to provide information, and it would have been great if we had another avenue or another way of actually delivering that. Okay, now, as I said, we launched in November 2018, and by December 2018, I was contacted by Lillooet Public Library, and they were actually quite hopeful initially to actually be a part of the project. The reason why we didn't contact them initially was they kind of fell a little bit outside of like the kind of the regional jurisdiction for one, and the other thing is Lillooet Public Library is a part of the Fraser Valley Regional Library System, and we didn't have Fraser Valley Regional Library System involved at that time, so we just thought we would just do it as a pilot. So what we did was to make Lillooet happy, I grabbed one of the kits that we had here, packed it up, sent it to Lillooet so that they at least had something that they could offer. In February 2019, I was contacted by Thompson Nicola Regional Library, and they are actually a consortial library that covers all the areas from like Barrier, Ashcroft, Kamloops, Lytton, Merritt, so on and so forth. And I basically shared and sent them all of our information, the templates for everything, the catalog records, all the promotional materials, and told them how they could actually kind of like link into actually getting set up themselves, which they did. And then in August of 2019, Kootenay Library Federation, which is kind of like, a little bit further out east there and north, they actually latched onto the program too. So I also did the same, sent them all the promotional information as well as all the stuff. So they didn't have to reinvent anything. They just had to get the stuff. Okay, so that's basically how it worked with the radon detection meters itself. And I just wanted to actually just switch gears here and talk about other types of things that libraries are offering in terms of public health resources and collections, programs, and services. One thing that we've been doing here, and this is actually something good to know, is a lot of libraries right now have it on their mandate to start diversifying their collections. So almost every library probably has it in their strategic plan to introduce non-traditional collections. So this is an opportunity to maybe touch base with your library, say, hey, we'd be interested if you guys could supply or circulate this kind of stuff, because a lot of libraries are looking for different ways to add different things into their collections besides just books, audiovisual materials, magazines, newspapers, ebooks, so on and so forth. So what we've been doing is we've been adding a bunch of different types of things. We started with kilowatt meters, power cost meters, and then we've been looking at other types of resources. So about 2 years ago, we added what we call happy lights, also known as sad lamps. Those are those seasonal affective disorder lamps. We have about 6 of them that we have available for people to take home. So basically it's a package in which you have that special little light in, and these could circulate for a total of a month. People could always renew them if they need them longer. And I think a lot of times people are just taking them just to test it out, see if that's something that they want to invest in. So that's one example of something that we have here. And we introduced that here at North Van City. The next item that we have here is memory care dementia kits. We're literally rolling these out now. And what we have is our home services department is now titled accessible services, and they're actually doing more than just large print books and talking books. They're actually providing other types of resources, especially for caregivers and people with dealing with dementia and Alzheimer's. So this is what we call a memory care kit. It's also a sensory kind of or a sensory development kit, and it's basically books, ephemeral materials, as well as different types of kind of like games and objects that one can actually do to actually kind of like stimulate the senses themselves. And these are actually proving to be quite useful for people, not as I would probably say more for the caregivers that actually, or for people who actually have like a parent who might be in a long-term care facility. So I'm kind of excited about these because there was some really neat stuff in these types of kits. I think of it kind of like fidgets, but for people with dementia. You know how kids like those little fidget kind of toys, but it's kind of like that. But it's definitely for helping people kind of develop a like a sense of or develop memory or a sense of place, as well as a sense of creating dialogue with whoever their caregiver is. Another item that we're looking at introducing pretty soon are going to be heart rate sensor kits. Because we kind of, like, as I said, we had this magic little list of things that we've been wanting to introduce, and we've actually had a lot of requests for heart rate sensors. So we'll be bringing those in pretty soon. CO2 monitor kits. Okay, North Van District Library and West Van Library just rolled theirs out, like I think about 2 weeks ago. And thus, these are basically kits which you could take home to monitor the levels of CO2. Now, it doesn't clear up anything or cure anything or whatever, but basically it gives you an idea of what the levels of CO2 are at home. We have already gotten a lot of requests for these, so I'm going to be rolling these out here at our library in probably about January. I would do it now, but it's the end of the financial year, and I'm kind of like just finishing up the budget. Okay, next item that we have here is, okay, this is an interesting one. About 5 years ago, we were approached by an agency known as the Edible Garden Project, which is a nonprofit agency in North Vancouver. And they actually provide spaces and places as well as seeds to the public. And they help the public basically create small little gardens as well as fruit and vegetable patches, flowers and things like that. So they asked, what they wanted to do is, their biggest problem was, we have all these seeds, but no way of getting them to the public. And I'm like, wow, we have a whole lot of public, but we don't have our hands on any seeds. So what we did was we developed and created a seed library. So a lot of libraries right now throughout British Columbia are developing seed libraries. And basically the way it works is we have a cabinet full of seeds in different little packages, all nicely marked. And we ask people, we make them available so people could come in, they join our seed club. They could take as many packets of seeds as they want for free. And we just ask people that when they harvest or collect their seeds at the end of a season, or basically harvest them, if they could donate them to us, we'll repackage them and make them available to other people in the community. We do have to top this up here and there, but we've had a lot of public response to this. Interesting thing about our seed library, I thought initially we might have 40, 50 people kind of involved with this. Right now we have over 400 people in North Van City who are registered for this. And on average, we circulate about 200 packets of seeds a month. So that's like, probably about 2,500 a year. Okay, next thing, partnerships with local mental health agencies and resource centers. Okay, I'm going to spend a minute on this one here because this one is one of my favorites. About 4 or 5 years ago, there was an agency that opened in North Vancouver. It was called the Hope Center. And that's essentially the mental health center, which is allied or linked with Lionsgate Hospital. In that center, they actually had a resource center or resource room, and it was called the Kelty Dennehy Mental Health Resource Center. And it was essentially a library that focused on mental health resources, and they have a collection of probably about, I would say maybe about 1,000, 1,200 books. And their issue was, well, they have the books, but they don't know how to circulate them and they don't know how to catalog them or whatever. So they contacted us and we've been working with them. So what we did was we cataloged and processed all of their items. And we essentially set them up as a branch of the North Vancouver City Library. So we link them into our ILS, which is our integrated library system or library catalog. And the nice thing is when you look in our library catalog, you can find books that we have here at North Van City Library. It'll also show the books that people have at the KDMHRC, the Kelty Dennehy Mental Health Resource Center. And all somebody needs to do is get a library card here. They could go there and take books out, and they could return them here at the library, or they could come to the library, take our books out, so on and so forth. So it's kind of like a joint venture that we're working on with the folks at the Resource Center, because now they actually have the ability to circulate materials, like checkout materials. They have the ability now to create library cards for people, and they also have a way of actually maintaining an inventory and catalog of their materials. So that's something that we do in conjunction with them. They do supply us with a bit of a stipend every year. It's only $400. That's all we really ask, but it's a really great way to link the public into other types of resources in town. Now, we have a collection of mental health resources here, but by far, I would say the one at the Kelty Dennehy Mental Health Resource Center is way better than ours. So it's nice to be able to send people from here to the resource center. And the nice thing is they're only about 2 blocks away from us. So that's real close. Okay, other types of things that we're doing. Currently, a lot of libraries and their strategic plans or their strategic priorities are looking at things such as indigenization, decolonization, and equity, diversity, and inclusion. So we're offering not only collections, also programs, as well as services that reflect this. We're really trying to kind of diversify as well as make our practices and all of our resources and services as inclusive as possible. So that means developing other types of collections, which are non-traditional collections, providing access to materials both in print as well as in digital form, and doing other types of like out of the box thinking, such as providing story times. And I know we've had actually a drag story time here at the library. I know this is an advertisement. And this is an advertisement for another library, sorry, a Stanley Miller Library, which is in Edmonton, the main library in Edmonton. But we actually have Connie Smudge, who actually comes in to do a show for us once in a while. So it's really quite neat because, you know, it's kind of just stepping outside of, you know, just your traditional story time, you know, with babies or toddlers or preschool kids. And it's actually been quite popular here at the library. Okay, next type of things that we have, and just keep in mind what I'm actually talking about here. This is just a smidgen and smattering of the types of things that we're doing or some local libraries are doing and all that. So I'm just saying that this is a way for us to start thinking of outside of the traditional collections, the traditional services, traditional programs that we have. This is actually one of my favorite ones, and we started this like probably about 1.5 years ago. We started something that we actually called the Warming Center because in inclement weather, that sometimes does happen. We actually have like a large population of people who are either homeless or dealing with food security issues or basically support issues, and they just need somewhere to go. So we created a warming center, and so when the weather's really bad, we had it on every Friday that people could come in, and we would actually have hot coffee, hot chocolate tea, as well as light snacks available for people in a nice warm room, set up with things such as puzzles, games, and we would actually have a librarian working with people that would provide referrals to the public if they needed any kind of assistance with anything. So we started this warming center, but the neat thing is we have since developed, we now actually have something called the Open Door Community Hub. So 2 to 3 times a week, we actually host essentially a warming center, but it's expanded into many different ways in which we actually offer lunches. And it's usually like about a 3 to 4 hour program in which we essentially have like a special room, just kind of like, you know, all set up for people to come in just to make connections with other people, or just to kind of like warm up, or just to kind of like get out from the cold, or just have a safe place to go. And what we also do is during those times, we actually have some of the social workers that come in from the Lookout Society here in North Vancouver, and they provide referrals for people to like for things such as housing, the food bank, as well as like workshops on how to fill in a resume, how to fill up applications, and things like that. And I have to say, the neat thing about this program is initially we used to have a whole bunch of different disparate, you know, like, you know, individuals that come into the library, and sometimes they could be a little bit of a challenge to kind of work with or kind of like maintain. But the neat thing is with having them all together, and it's always the same people that show up for that, they have completely developed community, and they watch out for each other and help support each other. So it's really, really great. We've also further kind of developed this program in which we're now offering occasional art classes, art therapy, as well as foot care clinics, healthcare clinics, hair cutting, and also packages and resources that people could come to the library to pick up. We actually have something now that we are called Zach packs. Essentially, it's a waterproof sleeping bag, which is available to people. So if somebody actually is homeless and they basically just need a warm sleeping bag, they could come to the library, they could get one from us. We're working with a local North Shore agency that's providing these to us for free.